So I would like to be talking about the and so why this ADHD and the new novel diagnostic entities are so much important, and so and the 161 people showed that. So we have 13.8% of ADHD patients are diagnosed in our country, and it is Guillermo Polanski's reviews and the metabolism, and especially for the 8 to 12 years old. So we have performed, and as in our many reviews, we have seen that it is 12.8% prevalence of childhood psychotherapy in our country. And as I told you before, I'd say that as I told you that what happens if it is not treated? Unfortunately, it leads to many major health issues as well. So, if especially in the 8 to 12 years of people, so if we treat these patients, so we prevent the risk of dependency, and also about the it is a very, especially ADHD. Of course, it decreases the lifespan of a poem, so it reduces around 8 years, so steals 8 years of your life. And in Manuzaki lines from 1990 to 2000, and there is an ADHD, and a follow and review work has been performed in New York, and after 30 years of so in Javier Castillo, Samuel Cortins, they call these patients to MR, and so of course MR provides very important insights, and for example, compared that compared, because these people suffer from the malnutrition, the mortality, and also alcohol addiction. Addiction rate is also is increased on these people, and therefore so it is not only it's about the it is not it and especially occipital professional strata disorders, or apart from these aspects, it is one of the most important findings that MR imagining causes, and especially on the third page, accidents, for example, shooting at home, and also or falling from somewhere. We knew that actually they can be the victims of the non-treated ADHD patients in the past, and therefore, as a part of the same training, I think that we see that the people that went through the same kind of training, education, did not earn the same level, not successful in equal level in their marriage, and that is why that early diagnosis and the treatment of these patients are so much important, as it is directly related to their future life. That is why we would like to talk about these the new diagnostic entities in this session, and of course on the conventional as a part of the conventional review and assessment. So we have already did, but especially for the scaling course prediction was the one of the most important topic as a part of AI in the studies in our country, because these scales can be very much predictive indeed, especially when we involve the machine learning and the deep learning. So it can be be as predictive as the semi-structured review and structure interview with the patients indeed. And so that we have, and for example, the kappa findings and their the overlapping are not so much higher. And however, get even though some sources considers the teacher review and opinions as a secondary part of our work. So, and however, the parental reviews and interviews and the findings are really so much important. And all of them starts with the training of the parents, starting from the early age of the early period of the childhood. And so Ayşe Kutlu, Sibel Kutlu, and Ülkü Deniz, so we performed their thesis studies at the same time, and in the Murat Atta Cultural Center. So we all worked about for embedding the parental training as a part of this ADHD training. That is why that it is so, especially on the MTA study, as the primary research is already mentioned. So it cannot be statistically be reflected, but still it is the primary treatment before the school age. And so of course it should be structured training, a good, well-tailored training and education for the parents. And so of course there should be some rules, disciplines, and there should be some pillars of the training and education for the parental education and training. So it of course it should be well structured. There should be well ordered training set of trainings for the parents as well. And also methylphenidat and atomoxetin and guanfacine, and especially for it is something that is known by everybody. But and however, yes, that we know that it is a hyperactive child. It is an adolescent hyperactive, and everybody thinks that they know about this disease. But unfortunately, it is one of the least known disease in our society. And especially if we can diagnose the efficacy level, and for example, dextroamphetamine, for example, have around 5% efficacy exists for this, and for we will be having viloxazine. And so so of course we don't have any issue about the medication, amoxicillin, methylphenidat, and guanfacine. We can cover majority of our areas, and so they are of course elements of a combined treatment. So I have to recall one of our seniors without any integrative treatment. So of course without an integrative treatment, so it means if you don't have it, it means that there is something lacking behind. And however, what informing the parents use of the medication, especially during the school age and after the school age, and of course should be combined with a sportive activity as well. These were all conventional treatments. So but what can be do next? And they say, and they have talked to the child. Then so then he diagnosed the hyperactivity for the child. So what else can we do? So they are always looking for a biomarker. So they would like to, for example, seropositive or seronegative is what they want to see actually, and they would like to repeatable pathological biomarkers. Is the expectation of the people to see. And so in 2011 the biomarkers and were diagnosed especially. And so this and attention about this biomarker lookup, there is an So that there should be at least 3% effect. The size of approximately 3% is needed for a clinical.
It was in 2016. It was in Halit Culture Center in an amazing conference room. It was an international conference, and there was a format at the Congress, and it was in the form of debate. There, one group was stating that there is biomarkers in hyperactivity, and the other group was stating that there was no biomarkers. And an expert in neurofeedback stated that there is actually biomarkers applicable to attention deficit disorder. In the study conducted in 2016, we received a slice of that study. In 2016, it was seen that there was not yet any biomarkers, but the studies continued to reveal the existence of biomarkers, and this is a very comprehensive study, and the effect size included three biomarkers. One is vitamin D, and the other is magnesium, and the other is the blood lead level. But be sure that none of these are satisfactory at the satisfactory level. Biomarkers is just only the candidate to be a candidate, and the people who are mixing the pages of the old journals will know that in the American journal will be familiar with octometers, putting diagnosis with the clocks. At the first glance, it seems logical. The hyperactive child is so active, but this is not so simple. It is open to interpretation, and generally these children can be hyperactive, yes, but sometimes they can be very immobile, very calm. This is the octometers measuring the hand and arm movements during the sleep. This is a little bit convincing for the parents because these children have many sleep disorders. This can be an important biomarker. What about the virtual realities? Of course, it is very interesting to the parents. The virtual reality includes combination of reality and the fiction. There was the Congress um, back in the past when we were young. The drug companies were so big that for the first time, the bipolar patient was diagnosed with virtual reality, and it created a dramatic impression. Uh, it, there was a simulation in 2002 where bipolar disease patient was diagnosed with virtual reality. So after that time, it started to be used almost in every practice. Its most crucial part is that it imitates the class environment. However, its impact level is not high enough currently, but of course it has a high commercial volume and aspect. It has two types of usages. One is about the treatment and the other is about the diagnosis. Virtual reality is defined as the scenarios which can be used to better understand the reality situations while putting those realities regarding the problems in the ADHD. Here are the aims of the virtual reality machine. It is to determine any disorder, any disruption in the executive functions, and also any insufficiency in organizing the ordered activities, sequenced activities. Also, a class environment was created to determine the ADHD students and educate those students and gain them behavioral skills. Let alone the virtual environment, they created an actual physical class environment. And one scientist said that, of course, there's a perfect classroom environment inside, and these children are staying quite calmly. But while they are waiting in the elevator sequence, they are just fighting with each other and they cannot stay calm. This indicates to the existence of lack of impulse control. So the approach that let's create a virtual environment and let's teach those children with ADHD how to stay calm, how to control their impulses. Well, this is not quite simple. This is not direct logical. So, because we know that a child can play virtual games very well, but that the same child can be not good at controlling his her impulses in the real life. And here you see that they are drawing paper planes, they are doing attention distorting activities in the class, and shift tests are conducted. But as I said, all these tests are only preliminary, not yielding any precise conclusive results. And also, um, the impacts of methylphenidate was studied, but we need much more implications. These studies are not enough. Again, it has benefits in certain areas, but it has limitations in other areas. The second aspect is that regarding the reduction of impulsibility, currently it is of much, if it is of lesser use. There is also MOXO DCPT test, and the tests are not enough to put to diagnosis because the reaction time is important. This disease is the instability of the instability, because the performance of the test and the perceiving the variability during the reaction time framework is necessary. However, this is not achieved yet enough. After using these free trials for a certain time, it was started to be discussed frequently. It is used in the scientific studies. It reveals the pre and post situation very well. And our study was introduced in the American web page in 2014. Before the medicine and after the medicine, CNS was evaluated. I think this is one of the best possibilities in terms of usage of the technology. The other is the eye tracking test. In 2015, while this initiative was at the very beginning process, we made common studies with the universities regarding the eye tracking, but now we have very advanced glasses and tracking the eye movement can give very detailed information, not only about the ADHD but also about the autism and Asperger's syndrome. This is a very open area. I suggest the young colleagues to investigate into these eye tracking studies. What is the greatest problem in ADHD is the default network. I mean, when you just put the gear into empty mode, the uh, thoughts keep coming to the mind. However, we are able to track those thoughts coming to the mind through the eye tracking. The eye staying dynamic, mobile all the time indicates that there are thoughts coming to the mind. This is compatible to the theoretic aspect. When AI tracking method is used together with the CPT, it yields more accurate results. I think its feasibility is very high because it can be implemented in the university. The other method is wearable technologies. For example, you wear robot-like clothes. There are numerous wearable technologies. There are calamus emotional traits to be followed. DNS added this lack of empathy group, which those people both harms the another person and doesn't feel any remorse, and they do not show any performance anxiety. So at that time, the pulse of the person can be tracked through those wearable clothes. The results yielded so far is negative, but I think that these wearable technologies can give great idea combined with the cardiac technologies. And regarding the autism and anxiety and ADHD, these can be tested through the clocks. Um, in this study, this Veda study is the most comprehensive study that I have seen regarding the wearable technologies. There is a sensor cloth worn by the person, child, and the child plays all those games with by wearing that cloth. There is CPT, go no go, Wisconsin during the Wisconsin cost test, etc. Combining all these with the other tests, as I said, the upcoming, the tests conducted so far appeals also to the parents. Yes, another issue is neurofeedback. Let me tell this initially. Neurofeedback is effective, but uh, does it have any difference than the sham neurofeedback? No, it doesn't. I read all the studies in the literature, but it doesn't have any feedback from the other. And there was Samuel Cortis as the guest researcher, etc. We sat together, we did this test, uh, but it just doesn't matter because almost every interaction which involves a person dealing with and paying attention to the and caring about another person is of course beneficial. The attention of the parents is invested also in those studies because they are paying money after all. It will of course yield positive results if no big mistake is made. Erjan Arnold says this. He says that regarding the English royal family, let a group of people do it if they have enough money, if they just want to try it. The most successful example that I witnessed is this: as the child concentrates on his her toes the astronaut in the space fall downs. In this way, you are trying to arrange the theta beta waves. There are miscellaneous different games appealing to the children for these test purposes. But what is the main idea? What is the gist of the summary? And what if we are to treat the attention deficit disorder through medicine? We don't know yet whether we are creating any permanent result, but teaching the neurons through these ways can be possible, they think. But especially in 2021, Kazranuria conducted ephemeral feedback studies and published it. However, through ephemeral feedback, this study became more applicable, but it is not feasible yet, and therefore it was just not continued. And there are quantitative EEG studies. Can it be used for diagnosis or for the follow-up of the treatment? This is open to discussion. And it is about the perception or regulation of the theta. I really urge you to know functional close beyond red spectroscopy, and its application is much easier and regarding the than the other MR types, and its areas of usage can increase in the future, and its affordability is higher also. Can you hear it? Okay. This game, what this is a prescription drug written by prescription NDVR Arcus. It was approved by FDA in 2020 and our OTC. I played this game. It is not complicated at all. The purpose is to teach the thinking mode as stop, wait, and think in order to control the impulses. And it is sold to many countries of the world as franchise. But the important thing is that this game is perfect and it appeals to the parents and the children. But the problem is that it never creates any development in the ADHD levels, the course given by the parents and the teacher. It just creates an improvement in the neurofeedback levels. Uh, the impact created by a game is not the same with the medication. The medication and any medication can get FDA approval only after a very long time and very much effort. However, a game can get FDA effort much easier. Can it be feasible? But yes, but the only problem is that the children are accustomed to such place that this is not liked by the children very much after a certain time, because the children are already accustomed to other complicated games. The children are playing GTA and other much complicated games. They find this game boring, and they worked with China and Brazil, and after we accepted our own protocol, only after then we accepted working. The protocol was giving importance to the device, but our protocol was based on trying to understand whether it is actually working or not. This is a similar game. There are very reliable studies, including the Philips success, etc., Bruce etc. And We conducted this study with Ahmet Biber from Denizli city of Turkey. The purpose here is to understand whether it is working or not without changing the last 6 months treatment, and for the patients having at least 3 symptoms, we try to understand whether it is contributing any benefit or not. And there are at least 3 or 5 symptoms in the cases. This is a criteria, necessary criteria, and uh, also these are the data collection tools, and um, these these are the non-invasive ways to stimulation. I'm skipping this homotherapy and acupuncture, etc. There is not much new development so far. We are not expecting any future from these. And also, there are the interventions based on mind body therapies involving the parents, and parents just educate themselves to better help their children. And there are the medicines used in ADHD treatment. These are the stimulants, non-stimulants. These are the conventional drugs. The new one is the viroxazine. It was approved by FDA only last year. The biggest advantage of viloxazine is its ability to predict for combination of anxiety and ADHD in order to treat both, if this is possible through viloxazine. Both are antidepressants, and atomoxetine is not used now, and viloxazine is an antidepressant which existed in UK. It proved to be effective in ADHD. All the ADHD drugs are very dominant, and they also have therapeutic properties. This is important. The biggest the among all these medicines which seem to be which seem to be promising in the future is paroxysmal antihistamine. So we are always looking for biomarkers. Actually, I found a biomarker. This is, for example, I was very active when I was a child. I don't understand why this is so. I wish could score high in my lessons. I am naughty according to other people. I wish I could be a calm person. This is a self-indicative biomarker written by a child, himself or herself. For example, for the attention deficit disorder scale, out of 9 articles, 9 was filled, and you also have above 5 standard deviations, which indicate to behavioral disorder. In almost all the numerous clinical studies, if while the average of all the cases was uh, 1.19, if 9 out of 9 is positive in a person is failed, this is not for vain. This signifies to a reality. We should not disregard this. And again, this instability disease can be seen in a child in a child playing game and studying his lesson. Okay, thank you.